Thank you so much, Louis, for a very nice presentation of me. Thank you. It's a pleasure to be here and to share with you all our experiences in non-invasive PGT-A. And we come from Ovumina group from Finland, and we do believe that the world is non-invasive in the future. We are going in embryology all the time towards non-invasive technology, and we do believe that also in PGT-A, non-invasive is the way to go. And as already Professor Alcatraz mentioned, it's a prioritizing of the embryos, and that's what we are sharing, how we think about it, we are sharing with you today. So thank you for giving this opportunity. So, can you hear me properly, by the way? Yeah, good, thank you. So, my part, I'm going to go through our lab protocol quite in detail. And what we have been doing in our clinic is that we've been focusing on the washing procedure. So we have been changing it during the years a lot and been focusing on the very, very minor details, how to minimize the maternal contamination in the sample. And I think that's one of the key things in the IVF lab that you need to focus on, that you think about how you wash the embryos. And now that I got the opportunity to talk today, I'd like first to go through the contents of my presentation, and also now to give you a short introduction to our group, Ovumina group, that what we are today. And I'm also going to go through our counseling procedure, because in our clinics we always consult patients before them taking the PGT-A. So our embryologists give a talk with them, and we go through the protocols, and then they decide themselves that if they choose for non-invasive way or the biopsy to take a sample. And then we go through the lab protocols, and then in the end, just very shortly, how our doctors prepare the endometrium for frozen embryo transfer. So, Ovumina group. So Ovumina was actually, it was founded 2007, and I joined the company in the very, very beginning, and it's been quite nice to grow with the company and also to be involved with the development of the group. So we started as an IVF lab, only laboratory services for University Hospital, a big hospital in Finland, Tampere. And then little by little started our own private clinical services. And nowadays we are a quite big group already and been growing a lot during the last years. So we are Finland-based, and we have 4 Ovumina clinics in Finland, in the capital of Finland, Helsinki, and then in Tampere, where the headquarters are located, and in Jyväskylä and Kuopio, which are a little bit smaller cities to the north from the southern coast of Finland. And then we have a clinic in Estonia, in the capital of Estonia, in Tallinn. And recently we opened one clinic in Sweden, in Stockholm. And then we also have one clinic in Ukraine, in the very western part of Ukraine. 80 kilometers from the Polish border, and we have there a gynecological clinic, which also has an IVF unit there. And our way of working is to have partners, and I think that Bioarray is actually one of our main partners also. And we have a partner clinics in 7 countries in the Europe, and they are top European clinics, and we work with them in donation programs mainly. And our key services are actually egg donation and sperm donation treatments. And then also the pre-implantation genetic testing is one of our key techniques that we offer. Nowadays we are 250 medical nursing and embryological experts, and of course without the people we wouldn't exist, so they are very important, all the experts for us. And we are in the front line on developing new things, so our kind of philosophy is to think out of the box, and we want to also be involved in developing new techniques to service our patients, which are of course the most important. Okay, a couple of words about the counseling, just very shortly. So we want to talk with our patients that are considering to take PGT-A in their treatment, and they've been maybe discussing about it with their doctor, or then they have got the idea by themselves. So our embryologists always give something like half an hour or 1 hour talk with them, and we go through the laboratory protocol, what happens to their embryos in the lab in detail. We tell them, and what is the sample for, and what can we find from the sample if we take the biopsy or if we take the spent culture medium. We compare the differences, which are actually not so many, and tell them honestly what we expect in their treatment, and taking into the consideration also their background in the previous treatments. And in our clinics, we think that the only biological indication for aneuploidy testing is the maternal age. That's how we think it. And so our patients are relatively old in age. The female age is it's over 38 years, and so it's quite seldom that the younger patient is taking PGT-A. And I think Peter is going to talk about more about the advanced maternal age and its effect. And in the counseling, the patient will select if they opt for non-invasive sampling or biopsy. And it was a bit surprising for us when we started 22 to offer clinical use of non-invasive PGT-A that our patients were so interested in it. It was actually a very, very big surprise for us, because we, of course, honestly informed them that this is new for us. It's a new technology, and we don't understand everything yet. We don't know how reliable it is, but little by little we do learn, and it was really the choice of the patients, and they selected and opted mostly non-invasive over the biopsy. And the biggest concern is in the mind of the patients that what happens to the embryo when you take the biopsy? Does it harm the embryo? So they are very concerned about that. So non-invasive way of taking the sample is what they wish for. And then some of the patients have informed, I gave a counseling for one of the couples that were very much in concern of terminating embryos that were analyzed with biopsy PGT-A as mosaic. And they were very worried that these embryos are maybe terminated and not used in the treatment, and they were very concerned on the possible false positive results that you may get by biopsy. Yes, we do recommend niPGT-A if there has been a poor embryo quality in the previous treatment, because we think that for poor quality embryos, the non-invasive way is maybe not harming the embryo that much, and then it would survive better after thawing. Okay, then to the laboratory procedure. Quite in detail, I will go it through. So for non-invasive PGT-A, we always culture the embryos in time lapse, and we have an embryoscope, and it's always used, as I said. And the reason is that we want to see the videos. We want to understand or maybe get some explanations to the results that we see or get from the spent medium sample. And I think Peter will talk about that more later today. We culture the embryos in the Cooper Surgical's continuous culture medium, the SAGE one-step medium. And we pay a lot of attention to denudation of the oocytes. So if ICSI, we denudate the oocytes on day 0, on the collection day, of course, and we wash the oocytes quite extensively in denudation on 5 well dishes. And then on day 4 wash, we use multi-well dishes and also some Petri dishes, and wash altogether 5 times on day 4. And actually there's a picture there below here. You can see that what kind of dishes we use. And when we culture in embryoscope from day 0 to day 4, we use this kind of group culture. And from day 4 until day 6, we use individual 8-well slides where the embryos are sitting in individual wells. And as I said already, we wash 5 times on day 0 or day 1 if it's IVF, and 5 times on day 4. And we think that it's not only the number of the washes, but it's also how you wash. And this is our lab routine, and what happens on each day. From day -1 to day 6, we always culture the non-invasive embryos until day 6. Because for some reason in our hands, day 5, it doesn't work as well. So we decided to go for day 6. So of course there is some preparative work that you need to do on day 1. So you, if it's an ICSI treatment, you of course prepare some slides and also take the washing buffer and dishes to warm up. OPU is done just by normal routines, and if it's an ICSI treatment on day 0, you of course do the very excessive denudation and washing, and then just do the routine ICSI, and then you start the time-lapse culture. And if it's IVF, we don't really favor ICSI over IVF for our non-invasive patients. It's just a matter of the sperm quality. So if it's a good sperm, we do IVF. And so also for IVF, we do very excessive denudation and washing on day 1 morning. And then, of course, just check into fertilization. And then when we go through the days, on day 2, we check cleavage, of course. But for a non-invasive protocol, we do some preparation on day 3, prepare the washing dishes for all the embryos, and also the final time-lapse culture slide for non-invasive sampling. And these, as I already mentioned, these are now individual wells in which we culture, and of course 10 microliters of the medium volume on those slides. And on day 4 is the washing day. We perform day 4 wash always in the early morning. First thing in the lab, when the personnel come in the lab, they do the washing. And 5 times, and then the time-lapse culture is started. And these washes are of course done so that every embryo is washed separately, and the stripper tip is changed between the embryos. And in the day 6 early morning, we do the vitrification of the blastocyst and collect the media samples. And some tips and tricks that we have learned during the years, what you need to consider. I think that in the previous talk, quite many of this was already mentioned. But of course, the cross-contamination is need to be avoided. So you need to pay attention to that. And of course, sorry, how can I get back from here? Yes, thank you. So, of course, the removal of cumulus cells is very, very important to do it very carefully, so extensive denudation. And then also, I think it's important to pay attention to the day 4 wash so that you take enough time to perform that also. So it's actually quite laborious. So many people ask that if it's easier to perform non-invasive over to biopsy. That as an embryologist, I would say that biopsy is easier because it takes less time. This washing takes time, and you need to do it very carefully. And then what about the paternal, potential paternal DNA in IVF? We think that spermatozoa don't release any DNA themselves because it's so hardly packed, and it's actually very difficult even to isolate DNA from spermatozoa, but they may carry some DNA, some cell-free DNA. So of course, also removal of all the cumulus cells after IVF, and also removal of everything that is excessive there is very, very, very important. And naturally, the lab staff can also be a source of cross-contamination. So I just took a picture to show you that in our lab we routinely use we cover the hair, and we use masks, and we do have a long-sleeved lab coat in the lab. So we have got used to already using this kind of clothing that is protecting the sample from our DNA. But it's of course very important during the sampling not to cross-contaminate by the staff. And then also you need to protect your samples because there's not very much of DNA in the spent culture medium, so you need to collect the medium very carefully, and also we always spin the samples and then freeze them immediately after collection. And we were very worried of the large day 6 embryos because we realized that to get good enough concordance, we have to culture them until day 6, and we didn't have much of experience in culturing good embryos until day 6. And that is, I think, the main concern maybe in every lab starting non-invasive PGT-A, because we never saw them before. Because of course, in a just normal lab routine, you just transfer or use the day 5 good blastocysts first, and then you culture the slowly ones or poor quality ones to day 6. So you never see good day 6 embryos, and once you start culturing them until day 6, they are huge. They have so many cells, and they don't even fit to the very small well of the time-lapse slide, so they just swim around in a way in the well actually, and we were very worried that do we know how to vitrify these, and how do they survive after warming them, because they are so large. Do we need to rethink of the vitrification process, or do we need to prepare the endometrium differently? Do we need to transfer them maybe later than we normally do for day 5 good blastocysts? And we did some optimization to our vitrification protocol and started collapsing the large, very, very large blastocysts. So we do collapse the blastocell, and because we think that the cryoprotectants need to get properly in the cells of the embryo, and we think that once you collapse them, maybe then everything happens fast enough. And that is actually the only change that we did in our routine vitrification protocol. We do the dehydration and rehydration as with normal routines. But then you need to handle the embryos very carefully, because many times they have already hatched from the zona, and so they are a bit trickier to handle. So you need to have a large enough pipette, and you need to load them on the vitrification carrier with some excess media. Okay, and I think this is my last slide. This is just very briefly, I'm not a doctor, so please don't ask anything about this. I just got some information from our doctors, how they prepare, because our patients are with quite high female age, so many of them don't have a regular cycle anymore. So most of the frozen embryo transfers are done after hormone replacement therapy. So you can see the medication there. So estradiol valerate is started on day 1 of 3 of cycle, and then after about 10 days, the patients get an ultrasound scan to check that have the endometrium grown enough, and if everything is all right, then the progesterone administration is started, and we use vaginal progesterone twice a day, so that it's 200 milligrams in the morning and 200 in the evening. So the total dose is 400 milligrams, and it's started around day 13. Depends, of course, on the growth of the endometrium. And then on the 6th day of progesterone administration, the frozen embryo transfer is performed. And for some patients, we do control the progesterone levels. And then gonapeptyl is administered 1 or 2 days after the frozen embryo transfer. This is to block the endogenous hormones. And then the estradiol and progesterone administration is continued until the pregnancy test is performed. And if it's positive, then it's continued until the pregnancy week 10. So this is our routine. Okay, and then the last slide is our team in Tampere clinic. And now that I get the opportunity, I of course want to thank, the biggest thanks goes to my husband Peter Bredbacka, who is really the brains of our clinic, and he's always thinking very innovative way out of the box, and we have kind of grown with him to think like that also in our lab team, that we want to discover new things, and this non-invasive world is really, really interesting to think about where the DNA is coming from, what does it mean, and what is correct and what is false, and we try to explain the results that we get with Bioarray. And I think that it's been really great to work with you guys in Bioarray, because you also have very similar mind as we do. So I think it's great development also in your team. Thank you for that. And of course, our lab team is the key to everything. So just want to present them. They are very eager, and they are very hardworking, and they are always smiling. As you can see from this picture, they are lovely people. Niina Viitanen is the key person. She's the one who is always taking the patient first and is giving very nice counseling for all the patients, and also after counseling as well. These are our youngsters. They have quite recently started, and they are already really good embryologists, both of them, Janette and Tara. And our lab director is now on maternity leave. She would have been here if not with a small baby. And of course, our senior embryologist, Päivi Aaltonen, is also a team member. So thank you very much for your attention. I hope I didn't exceed my time too much because I started talking too much. So thank you.